Hello, my name is Alison Neill, student nurse at UTS. Today I will discuss the contemporary nursing issue of open disclosure in adverse events and how it is related to nursing practice, patient safety, and a healthy workplace. I will define and explain what open disclosure is. I will then relate how open disclosure is relevant to contemporary nursing. I will highlight what is expected of new graduate nurses. A clinical incident is described as an adverse event or circumstance that could have or did lead to unintended and unnecessary patient harm. A clinical incident can then be categorized in two ways, which are an adverse event, in which harm was caused to a patient, or a near miss, where harm was not caused but could have if the issue wasn't identified. Examples of an adverse event may be the administration of the wrong medication, resulting in harm or mortality. A near miss may be almost giving the wrong medication to a patient, but then identifying the issue before administering medications. Gone are the days when healthcare services and professionals avoided admitting that something has gone wrong. Instead, open disclosure is used to manage events and reflect on practice to prevent further incidents and reduce risks. Open disclosure is the process taken when a clinical incident occurs. This process is an integral part of the New South Wales Health Incident Management Framework and is considered best practice. Open disclosure is the process of ensuring timely, honest, empathic sharing of information between healthcare professionals and patients, carers, or families when an adverse event or near miss occur. Open disclosure not only helps relieve anxiety and emotional stress on patients, but also helps alleviate emotional stress of nurses and provides an opportunity to learn, reflect, and gain closure in difficult situations. It is known that adverse events can increase the length of hospital stay, increase financial and emotional burden, as well as cause harm, injury, illness, or even mortality. In 2014, hospital admissions were complicated by adverse events, with 6.7 per 100 hospitalizations in the public sector. It was identified that out of these events, 37% were medication-related events. The management of adverse events is vital for ongoing patient care and safety. So, an adverse event happens. What happens next? The National Open Disclosure Framework of 2014 defines 4 elements to facilitate this process, which are the expression of regret without admitting liability, factual explanation of what happened, identifying and addressing consequences of the event, developing steps to manage the event and prevent recurrence. As a new graduate nurse, it is a requirement for you to follow your scope of practice, code of conduct, professional standards, and core values. When a patient is harmed in the healthcare system, nurses must be open and honest. So, when the need for open disclosure is identified, who is involved? Patients, carers and family, registered nurses and midwives, clinical nurse managers, medical teams, allied health and executive officers may all be involved in this process. So, what is involved? According to the New South Wales Open Disclosure Policy, there are 6 requirements for open disclosure. 1. An acknowledgement the incident to patients and carers within 24 hours. Truthful and clear and timely communication. Provide an apology without admission of liability. Ensure care is provided to patients and carers that meets their expectations. Ensure care is provided for those who have been providing care, your teammates. And incident reporting and quality improvement. The Open Disclosure Framework identifies steps to take, which are identify adverse events or clinical incident, provide intervention to prevent further harm, assess the level of harm for further intervention. Once the clinical incident has been identified, this signals the need of open disclosure. Acknowledgement of the event, including an apology to patient and carers. Provide a health service contact detail for patients and carers. And avoid speculation of blame. Open disclosure involves a multidisciplinary meeting addressing the issue, gathering all relevant information. Patients, families, and carers must be directly involved with the open disclosure discussion. An acknowledgement and apology must be provided. Detailed information on what and how, encouraging patients and carers to exchange their views on the incident. Develop a plan to rectify the issue. Manage the issue and ensure it does not occur in the future. Open disclosure is important for a healthy workplace. It promotes an environment of openness, sharing of information without applying blame, and recognises the need to support each other as healthcare workers. So why is open disclosure important for workplace and patient safety? Open disclosure and transparency during adverse events provide empowerment for patients and carers by being directly involved in the issue. This will help reinforce the trust individuals have in healthcare. Nurses are involved in the process, which may lessen feelings of guilt, provide closure, and allow for personal improvement and development without judgment. Open disclosure is forming a positive, constructive solution to what may be a difficult situation. In a study, it was found that 42% of patients who experienced an adverse event felt like no one took responsibility, and 53% of people reported a damaged relationship with healthcare providers. In a study at the University of Newcastle, it was identified that after an adverse event, nurses wanted a structured procedure to manage events, share the information, and provide support to colleagues. If these steps were taken after an adverse event, it minimised psychological damage, promoted communication with patients, and strengthened relationships between nurses. These facts show a clear correlation between the issue of open disclosure and patient safety and a healthy workplace. So what can you do as a new graduate nurse? Prevention is often better than cure, and hopefully any adverse event can be prevented. There are many policies within the health system that aim to promote patient safety, correct patient identification, allergy alerts, between the flags protocol, falls prevention, medication administration policies, and the use of personal protective equipment are a few policies in the healthcare setting. When an incident occurs, it is your role to escalate the issue to the relevant teams, nursing unit managers, or team leaders. As a new graduate nurse, you will be expected to be able to manage an adverse event. Some steps you may take include intervene and prevent further harm, initiate a clinical review or rapid response, maintain documentation in patients' notes and incident reporting programs. Good documentation can provide an accurate reflection of events, changes in clinical status, and care provided. You may complete an Incident Information Management System, or IMS. Provide reassurance, empathy, and support to your patients, families, and fellow nurses or healthcare professionals. Open disclosure helps promote trust, provides a learning experience for staff, and promotes the relationship between healthcare services and individuals. The relationship between nursing environment and adverse events is undeniably linked, and studies have shown that stress, workload, skill mix, and interactions between nurses and doctors can influence the rate of adverse events in hospital. This video has been created to inform and educate new graduate nurses on the procedure of open disclosure, using visual, auditory, written, and kinesthetic teaching styles. As a leader, it is important to share information and encourage other nurses to learn, grow, and develop as a skilled registered nurse. I hope I have made the topic of open disclosure familiar so that you have the confidence to manage the situation in a clinical setting. Thank you.